My name is Danielle Roxburgh. I work within East Renfrewshire Health and Social Care Partnership. I am the Senior Occupational Therapist within our initial contact team, and I'm also the Rapid Access Coordinator. The Rapid Access service focuses on early intervention by providing equipment and advice really to enable the individual to maintain their independence and therefore supporting them, to remain at home. This can include everyday activities such as difficulties with getting in and out of bed, on and off your sofa, on and off your toilet, or even struggling to bath or to shower. Promotion and implementation of the Equip You, Ask Sara survey tool is also an important part of our service. With regards to the Rapid Access service, really the whole service was devised to sort of take away non-complex work from qualified occupational therapy staff. So it was really looking at who's the best person, if you like, to go out and to see the individual. And we're looking at upskilling some of the staff to maybe include things like looking at more in-depth falls assessments, because obviously we have quite a mixed range of people we see because we cover the whole of our sort of authority. So ultimately we see those who need seen sort of acutely due to a sort of functional deterioration. This can often prevent hospital admission for an individual. We also work very closely with our sort of health professionals based in the hospital as well to try and support the discharge, or get the person home even sooner than normal because of the access that we have to equipment and the other services available. So our referrals really can come from anywhere, GPs, as I said, other health professionals, and actually the individual themselves can refer into our service or their family member on their behalf. The challenges that we've had recently, obviously the biggest one has been due to sort of COVID-19. There has been an increase in demand for our adults and our older adults, requiring services in general. So we've had a requirement still, to reach out to those seeking support, and we've had to think about doing things slightly differently, obviously with the restrictions in place at times, rather than necessarily having to visit them at home. So that's really where our Equip You, Ask Sara survey came into place and really has potential to allow for a sort of preventative approach and supporting really a self-management model with the individual taking ownership for their health. Our service users, what we have found is that they may still require, a professional assessment or a home assessment, if you like, following that, mainly in our area due to the prevalence of kind of elderly individuals that we have. But we have found that it can work really quite well in conjunction with our home assessment. With regards to the sort of wider care system, Rapid Access in particular can support existing services, as we often work very closely with various different professionals and professional groups within our own health and social care partnership and external. We are usually the sort of first person, if you like, to visit the individual at home. Therefore, we can almost be seen as the initial link to other services for that person, including telecare, and particularly for those maybe elderly people that have a falls history, for a wider social work assessment, or even further rehabilitation input from our multi-disciplinary team. So in particular, considerations with regards to trying to implement the Equip You, Ask Sara tool into your service, really within my own organisation, we're trialling its use within, if you like, the first point of contact. So for a service user within a health and social care partnership. So our plan is to test its use within what's called our initial contact team, or our front door to services. And by that, we hope that may empower the individual, to take control of their health and ultimately, provide them with greater choice. Also, what I would say is raising awareness is very important. Therefore, use of advertising of the tool on, your local website for your health and social care partnership, or via GPs, and even with the local pharmacies, we've found that that's been really helpful as well.